Hello, good evening and welcome to the 37th online session of ICC Crack the Wellness Code. I'm Somnath Chatterjee, co-founder, executive director of ICC Crack the Wellness Code. A warm welcome to you. As you see, this is the 37th online session, and we have been regularly conducting this session, and we are very, very pleased to, offer an interesting session focusing on aesthetics in dentistry by Dr. Nipa Seth. You can see the schedule here. You can also see that right on the top, we have a link with webinars where you can see more than 40 online sessions covering different aspects of wellness. So definitely take advantage of that. And for June and July, we have 25 online session, and this is the link. You can see my mouse moving around. So this is online dash events. Once you go to the website, and you can choose any event that you want to attend. And of course, this is a nonprofit endeavor, and like in the past, we have a donate button on the website. Okay, so it's as you go to the site, you register for events and get updates. You can use the donate button to contribute to the digital project that is underway, our mobile app, web platform, and the entire content management, including video, podcast, and so on, which we are dedicating to the community. So Deepa is a doctor patron and, of course, an independent practitioner. We'll talk more about her as she joins us. Here's the mission of CWC: Educate, Inspire, Empower, and Impact. And this is the journey so far. It's been an exciting journey, and you can see how we have accelerated our initiatives to serve a very large section of the community, not only in the San Francisco Bay Area, but pan-US and also global. This is possible through our wellness ecosystem, which is truly remarkable in the sense that we have doctors, nutritionists, dietitians, chefs, wellness partners, a very diverse set of practitioners, and of course, a lot of health tech companies who are also helping to solve various problems. These are some of the events that we have for seniors, youth, and you can use the button on our website right on the homepage for the online events to register for any of them. This is a disclaimer and liability, which basically says that we are a third-party platform offering education and empowerment, not direct provider of healthcare. So that's something that you obviously do with your provider. And of course, we can at times help you to connect, but this is not a platform for direct provision of healthcare. So once again, welcome to this 37th online session. We would like this session to be very interactive. So do pose your questions and use the chat box liberally. We have question answers. So keep posting your questions. And as you also hear Dr. Nipa said, continue endeavor in terms of seeing how we could extract value given her experience and what she has been doing as an independent practitioner. She's also been serving the community. She had also been the board member of ICC. So over to you, Nipa. Absolutely a delight to have you. Okay, and Tell us a little bit about your journey before we start the presentation, and how are you spending your time during the COVID? How do you deal with your patients, and what's going on? I mean, how do you? A lot of people are very anxious about your dental and oral health. So how do you handle that? And what are some of the typical things that they ask you? And generally, tell us about the topic, your journey, and of course, then we would like to see your presentation. So over to you.
Hey, thank you. So thanks for that wonderful introduction, and thank you for having me, firstly. It's always a delight to do anything for ICC. So, and I hope that today's session is as engaging and as educational as the previous ones have been. I did sense some interest among the people, which is why I came up with this particular topic. So let's hope this is as engaging as the previous ones. COVID, yes, it has been very interesting. Dentistry wise, we have not been allowed to practice except for now, from starting June 6th.
Looks like India is going to go another lockdown second.
Yeah, so we don't out here.
Because it's exploding in India.
Yeah, hello?
Yeah, go ahead.
Yeah, no, so we, for lockdown, dentistry was mostly just focused on emergency services. So, if someone had a toothache or a swelling and needed to be taken.
There is khichdi if you want.
Most of it was around just giving them prescriptions.
I'm not lying to you to tell you that I think some.
Yeah, go ahead.
Yeah, just prescriptions and, helping them with their immediate need. A lot of dentistry, there's some interesting teledentistry services that have started. Of course, dentistry is harder to do, remotely, because you do need to see the patient, take x-rays, etc. But you can certainly, do at least the initial visit and help the patient out with their immediate need. Perhaps even give a second opinion, etc. So COVID has been very interesting in that respect. Also, as far as today's topic is concerned, why this particular topic in this time? Well, firstly, in some of these emergencies that came up, given that children were at home, given that, they had not much to do, there had been some unfortunate accidents where children do end up hitting their teeth and breaking teeth, etc. So how do we go about now, helping them rebuild those teeth? What is it that can happen with broken teeth? And that led me to this current topic, which is aesthetics, which is why is aesthetics in dentistry even important? Is it important? Does it really matter to everyone? And should it matter to everyone? And such. So I hope some of those questions can be answered. I'd love to make this interactive, as so mentioned. So if you have questions, please feel free to put them in the chat, and every now and then we'll stop to take these questions, and hopefully we can educate you further on this very wide topic.
So, Nipa, before you start your presentation, which you can set up, I was amazed to see a whole list of items which come under, aesthetic dentistry. It ranges from gaps between teeth to receding gums, crooked teeth, noticeably shorter or longer teeth, cracks and chips, stains and decoloration, decay, dental injuries, and of course, many more. Cracks and chips and decay, dental injuries, something that you talked about, misshapen teeth. We need to understand what that is. Weakened teeth, crowding, misalignment. So there's a whole lot of things. I think the participants can't wait anymore. So over to you, and let's go over your presentation, and I'm sure there are lots of questions coming up, and we'll have a really engaging session today. Yeah.
Sure, sure. Let me share my screen and okay.
Yes.
Can you see that? All right.
Yes, all perfect. Go ahead.
Okay. So firstly, let's talk about, since the topic is aesthetics or cosmetics, what exactly does that mean? As far as aesthetics in dentistry is concerned, as a cosmetic dentist myself, what aesthetics is patient driven. What that means is, within reason, if we are not doing harm, what we want to do is give the patient their idea of what looks beautiful on them. Of course, if there are things that are dangerous, then we do speak up. But for example, this person on the left, thinks that a gold tooth is aesthetic. Excuse me. There are certain cultures that think that gold teeth are either lucky or aesthetic or whatever have you. I am not somebody who can tell you what's cosmetic for you. So within reason, that can be considered aesthetic dentistry. Madonna, famous Madonna, it's not that she can't afford to close that gap between her front teeth. It's that she considers that aesthetic or lucky or whatever have you. So within reason, if she has requested her dentist to keep that gap, then so be it. We as dentists are not going to put our beliefs on patients to tell them, okay, this isn't as cosmetic. If someone asks me what an ideal smile is, I'll let them know. But as far as results are concerned, I'd rather base them on what a patient desires. So in short, aesthetics is patient driven. So these two examples are perfect examples of that. What do we as dentists focus on when we talk about aesthetics? For us, aesthetics takes a second stand, it's secondary to health of the teeth and the gums. What do I mean by that? So this picture on the left, for example, they have perfectly straight teeth. So as such, pretty, for as far as the general public is concerned. However, when I look at this mouth, this is not a healthy mouth. They have very severe gum disease, where if you can look, it's very red. These are called swelling around the gums because they haven't had a cleaning done. You can see all this plaque collected. You can see that these gums are very, very red and inflamed. They're swollen. As far as we are concerned, this is not aesthetic. But if you look at this person on the right, they have these pink, nice gums, healthy, clean teeth, and that is considered quote unquote aesthetic in our opinion. So health promotes dental aesthetics. When you have healthy teeth, they automatically look a lot better than unhealthy teeth and gums. So if you were to look at this person on the right, the big difference here is that they've had a cleaning done. This person has not. So just basic would be just to brighten your smile, just to make your teeth look quote unquote whiter. Your basic thing might just be go get a basic cleaning done or a deep cleaning done based on whatever your dentist is recommending. So again, when the dental health is affected is when the aesthetics are compromised. So the very first line of defense for us would be, are the teeth healthy? If they are not, then we focus on that first. Now, let's talk about certain situations where it's harder for a patient to keep their teeth and gums healthy. Let's take this particular example of what we call crowded teeth. What crowded teeth means is that there are way too many teeth that are fitted into a small space. Simply put, your jaw size is sort of smaller than the sum of all your teeth size. So these teeth can't fit into the jaw, so they end up getting all crooked. And as a result of this, so now let's see, when you have crooked teeth, what happens to the teeth in particular. We have this particular tooth that is severely crowded, as it's called, which is it's placed way inside. So if you look, it has a lot of plaque and calculus collected around it, because the patient probably finds it extremely difficult to brush that area well. Plus, obviously, they haven't been flossing. So you can see, based on the previous healthy gums that I showed you, these aren't healthy gums. These are red, inflamed, swollen. You can see here, they're very swollen. There's another red here. This is what we call plaque and tartar collected. So right off the bat, they are not healthy. Now, my first line of defense here would be, okay, let's get a cleaning done. However, like I mentioned, this person has such crowded teeth that it is practically difficult. It's perhaps impossible for them to keep it as clean as I'd like them to. So in addition to this tooth being crowded and having these gum issues, if you look at this particular tooth, you can see the damage done to this tooth here. It's broken, it's cracked. You see this crack line here. What's going on here? So what happens is that because these teeth are placed more outside than they should, the pressure applied on this tooth in particular is extremely high, and this tooth cannot take that pressure, so it starts to crumble. You will notice breakage, cracks, and everything unhealthy going on with this particular tooth. So and I will talk about what to do in a situation like this. But again, as far as health is concerned, these are not healthy teeth. And as a result, as a dentist, they are not aesthetic. Also, from a patient's perspective, just the fact that they are crowded and broken, it's not aesthetic. Now let's talk about the opposite problem, where you have spaced out teeth. What happens in this particular situation? It's the opposite issue, where you have way too much space, and either the teeth are smaller in size, or you just have way too much space. So there ends up being gaps in between teeth. So what's the problem with that? Well, what happens is, this is an extreme situation, but I have used this to show you what can happen with spaced out teeth. So if you look at the profile view of this particular patient, you can see that the teeth are meeting at a very bad angle. So these bottom teeth are hitting these top teeth at a very high force. So given that these two, you can see how splayed out they are. They spread out because the bone here and here cannot take that kind of force. So they continue to spread out and spread out and spread out. And you will notice, if there are people on this chat listening where they have spaces, they will probably notice that over time the spaces are increasing. And that is happening because of this. Because of the pressure being applied, these teeth can't take it, so they start to spread out more and more and more. And basically, you have a situation where you have, say, a minor spacing, but over 10, 15 years, if gone unchecked, you could have an unhealthy situation like this. So yes, so now we have these two really extreme situations. We have really crowded teeth, we have really spaced out teeth. Why, from a dentist perspective, do I want to correct this? As far as I'm concerned, like I mentioned, I am not interested so much in correcting the cosmetic value as I am in the health. So what I want to do with these is bring them to an optimum position where they are of ideal health. So your gums are at ideal health, your teeth are in their ideal health, you are being able to keep them clean, etc. So as far as a cosmetic dentist is concerned, that is all I would want to do, is get these teeth to a position where you can keep them clean, where they are not putting extra pressure on each other, and you're not having general breakdown as a result of it. So like I said, my treatment as a cosmetic dentist would focus more on the health aspect of your teeth. The aesthetics happens to be a side benefit. So what happens when the teeth are in their optimum healthy positions and their relationship to each other is that they end up looking good, because that's what nature thinks is best. So we have these beautiful smiles that we've seen among stars and such, where you notice that they're more pleasing than certain others. A lot of that has to do with how the teeth are positioned, where they're positioned, how small are they too small, are they too big, all those things that that So mentioned earlier, with broken teeth or misshapen teeth or any of that. So when I bring my teeth to, or the patient's teeth to, an optimum health, the aesthetics is always a side benefit. It ends up just looking good. So let's talk about, I'm actually going to take a little break here and see if there are any questions so far that have come up. And then perhaps.
Yes, Nepa, we can certainly do that. I can see the questions coming in. Yeah, and I think that way we could also connect with the participants better and see, what are some of the things that are running in their mind already after hearing you so far. So let's start with the first one, which says that I have a temporary bridge. Should I go for permanent bridge, or my dentist is calling me for appointment? So the question is, a temporary bridge, should I go for a permanent bridge? And my dentist is calling me to go for the permanent bridge. So that's the question, I think, kind of a dilemma, and wants to find out from you.
Sure.
Yeah.
And great question, because I can understand that in the time of COVID, you are especially concerned about whether it's safe to now go visit the dentist. So, so firstly, let's talk about what a temporary bridge is. A temporary bridge is made of plastic and acrylic, and it's really not well fitting around your teeth. So given that if it was done, let's say before COVID, then you've had it for at least 3 months. So there is bound to be leakage under the temporary bridge because plastic doesn't fit as well to the teeth as, say, porcelain or steel or something else would. So right off the bat, you do want to get it replaced. Now, to your unspoken question about whether it's safe to do it at this time, let me assure you, yes. All us dentists have undergone very severe training with ADA and such, where they've shown us how we can use protective equipment to protect ourselves and our patients. How do we sterilize in between patients? Some offices might even take temperature checks, etc. So in fact, it's probably safer now than it ever was to visit your dentist, because everybody around is a lot more vigilant, is a lot more educated, and wants to do the right thing. So in order to prevent further spread of this disease. So yes, it is absolutely safe to go visit your dentist now. Starting June 6th, we did get the okay from the county to start practicing. So I would recommend that you get your temporary bridge replaced with a permanent one, because that's, in the long run, that is what's safest for your teeth.
Thank you, Nepa. That was very comprehensive, and I'm sure the answer is, something which will help. Next question is very interesting. It says that what age is too late to fix spaced out teeth? Okay, to fix spaced out teeth. My cousin has teeth that have too much of gap in between. He's almost 40. What do you say to that?
So thank you for that question. I'm glad you asked it, and I will be addressing some of the treatments a little later in this. I am talking about what one can do with that. But in short, no, it is not late. We've had patients 60, 65, 75, just before they get their implants done. They want to bring their teeth to an optimum position. Also, who get treatment done, and I'll talk about that as well, because that also increases the longevity of their implant treatment. So will it be as effective as a child undergoing certain treatments? No, there are limitations. However, the products that we have today have worked around these limitations, and some of the very common, at least the cases that I've shown you in the pictures, are very easily treated with the products that we have available today. So I will, if Somit, there aren't any further questions, I can move on to the treatment, but if not, I'll wait.
There is one question which is actually getting to treatment. So what I'll do is I'll hold that question.
Okay.
And I think you're already occupying the screen with your slide. Why don't you go ahead? But this participant, I'm just requesting him. This is absolutely a great question. And we'll just hold it and we'll continue after the rest of the presentation from Nipa. So go ahead, please.
Perfect. So, so now what are some of these treatments that we can do to correct some of the issues that I showed you? So number one, like I said, cleaning, just keeping your teeth healthy, right? Seeing a dentist every 6 months, getting your checkup done. If there are rotted teeth and large cavities and such, from a health perspective, that's not good. And then obviously not from an aesthetic perspective as well. So, so visiting your dentist at least twice a year is extremely important, and getting your cleaning done is the basic thing you can do to help yourself. Now let's talk about slightly more advanced treatments to correct some of those issues that I've mentioned. So in very severe, crowded and spaced out teeth, like I mentioned, what happens is that the interrelationship between the teeth affects the entire bone, the teeth breakdown, etc. So now, obviously, our treatment would want to focus around how do we reposition these teeth? Can we reposition teeth? Can we change the relationship between the teeth so that they're not harming each other? So, so let's talk about the absolute basic treatment that one can do to change the positions of your teeth. So in dentistry, it's called orthodontics, and you've all heard of orthodontists. What the basic thing that you use, and now even adults use it, is something called braces. What those are steel or porcelain wires and brackets, and I'll show you pictures, that can treat crowded cases, spaced out cases, rotated teeth, teeth that are too much into your gums, teeth that are just severely positioned way in or way out or spaced out or whatever have you. And quite simply put, it moves teeth. All right. Let's talk about, okay, what are the different kinds of braces if you are considering it for your children or grandchildren? The very basic are these metal braces. And if you want to go slightly more aesthetic, then instead of the stainless steel, you have porcelain as the brackets. The wire is still usually steel, but the brackets are porcelain, so it's a little more aesthetic. These are the absolute basic braces, which orthodontists are the ones that treat your children for. What exactly do braces do? What braces do is they put pressure. So based on where this little bracket is placed and based on how the wire is placed, they put sustained pressure on the tooth. That sustained pressure helps move the tooth because of some bone changes that occur as a result. So now let's say this tooth is sticking way out. So then your orthodontist will put some extra, heavy steel wire, and then they'll put this pressure. And then obviously you might have heard that the treatment goes on for a year and a half, 2 years. In that period, the tooth starts to move because it's just a lot of pressure being applied over a period of time. So simply put, that's all orthodontics is. It's just sustained pressure applied in a particular direction over a period of time. Now, this is something that most adults will not prefer to do. A, for aesthetic reasons. B, it's painful. It's hard to clean. It's fixed. If you have, a wedding to go for or whatever have you, it's typically harder to deal with these. Do we have another option for braces? Yes, we absolutely do. So, about 20, 25 years ago, maybe more, we had our first company that came up with what they call removable braces. And they look like this. So they're not plastic, they're some patented material. But essentially, you put them in your mouth for a period of 20 to 22 hours, and it does exactly what the steel braces do, which is apply sustained pressure over time. So, and based on how these are designed, they will put the pressure in a particular direction and move the teeth in the direction that we want to. There are lots of players now in this. Invisalign remains, I think, the #1 in the market. Then there are clear braces, there's Bright Smile, there's this, that. There are quite a few of these removable braces that are now out in the market. What do these do? So let's see a video that will show you what exactly Invisalign or any other removable system does. Okay, this is Invisalign, but some of the other removable systems can do this too. So here we go. Okay, so you have this person with crowded teeth. This is how the teeth will be moved. And you see the result. Before and the after. So to the earlier question about whether one can do this as an adult, here is your answer. Yes, you absolutely can. These removable braces system, Invisalign in particular, was designed mostly for adults. Now, of course, teenagers use it as well. And what it does is what I showed you is you take your current situation. We have a 3D image of it. As a dentist, I would sit and play with that system and decide how I want the teeth moved, in what positions do I want them finally, and then this is your result. And this is with the Invisalign system. So, and this can be done with spacing as well. This is a crowded case, but spacing is actually a little easier than crowding to correct. So to again recap about braces in particular, what braces do is they change the position of your teeth. So if your teeth position are the issue, where you can't clean your teeth, where you're getting all these breakages, then as a cosmetic dentist, that's what I would recommend, that your teeth need to be moved to their ideal positions, because that would be how we would go about correcting everything else that has happened as a result of these teeth not being in their right positions. And with that, we have either braces or Invisalign or any other invisible braces system. Typically the treatment lasts for about, that treatment would probably be about 8 to 10 months that we just showed you. You have to wear it through the day, but the advantage is that they're removable. So if you have a wedding to go for, or you know, you have a presentation at work and you just don't want to wear it for an hour, you can do that. You know, so and there are a series of what they call aligners, where these plastic, you have to change them every 2 weeks or so, and the teeth are moved. So so that's as far as the braces treatment is concerned. I am going to stop here before I go to the next treatment, in case there are any questions around what I just talked about. So
Yeah, so what I'm saying is that we could, you know, stop sharing the screen, which you have done. So we can have a couple of questions. One of them was pending, a very interesting one. Can you talk about receding gums, and what is the treatment, and does it fix the problem?
So I'm sorry, I wish I had a slide or a picture or a representation of receding gums. But let me see if I can go back to one of the previous ones to show if there was receding gums in that. But, oh, anyway. What receding gums can be due to multiple reasons. One of the commonest reasons is, again, the position of your teeth. So what happens is, let's say your tooth, one of your teeth is placed way outside into the bone. When that happens, the bone that's on the outside is very thin, because it's just not enough to hold that tooth in place. When that happens, your gum doesn't have enough bone or anything to hold on to, and it starts to shrink back. So a lot of this has to do with, again, the position of your teeth, and the trauma that that tooth experiences, because of which the gum experiences trauma and starts to shrink back, or recede as it's called. That's number one. So again, the treatment fix is easy. You change the position of that particular tooth. This is if we notice, let's say a person comes in and I see gum recession in, say, 10 teeth as opposed to all 28. Then I know that something in particular is going on in those 10 teeth as opposed to the entire mouth. And if I look further, I know that a lot of it has to do with the way these teeth are taking the trauma. So it's a quick fix. They can either go on braces or Invisalign. Usually Invisalign is the preferred treatment, because the braces would put too much pressure again, and would probably cause further gum recession. Now, let's say if someone has generalized gum recession, where they just have straight teeth, everything seems fine, but their gums have just receded all over and they have these sensitive teeth. One of the lines of thought was that if someone's putting too much pressure on the toothbrush that they are using, or they're brushing their teeth incorrectly. So let's think of your teeth as a glass surface. All right. Let's say you want to clean your glass surface. If you take a very heavy scrubbing brush with steel bristles and go and scrub your glass, what is going to happen to that glass? You are going to get cuts, you're going to get marks, you're going to get dents, you're going to get all sorts of things in your glass. A tooth is not much different. It's made of, it's like porcelain. Its enamel is hard, but if you brush it at a wrong angle, which is horizontal as opposed to vertical or circular, then think about it like your glass surface. You're just putting so much pressure on your on the tooth surface, and you're cutting it, and and that's causing the gum to sort of say, wait a minute, I can't take this load, and the gum just starts to shrink back from all that trauma that it's experiencing. So can we grow that gum back? If there's very severe recession, yes, there are treatments that gum specialists can do. If it's mild recession, the treatment would be stop your habit. The first thing would be to educate the person on how to brush their teeth correctly and not put so much pressure. And like I said, think of it like your glass surface. You brush it the right way. You brush it enough to remove the plaque. But if you do extra, you are going to do more damage. So that's number one. And if a lot of people have sensitivity from these receding gums, then we have things like Sensodyne toothpaste and such that you might have heard of. There are these desensitizing toothpastes. What they do is they just kind of temporarily block the nerve endings on those receded teeth and can help some. You don't need to use that for a very long time. If you're using desensitizing toothpaste, you use it for 2 to 3 months and then give your teeth a break again and go back to your regular toothpaste and then come back to it. So yeah, those are some of the reasons for receding gums.
Great. The next one, interestingly, is on the bone that you've been talking about. So it says that, do the bone under the teeth get damaged over time? And what causes it? And what are the solutions to this?
So again, I'll allude to it a little bit in the remaining presentation, but bone is affected by a lot of different things, but the simplest thing is not cleaning your teeth. So let's start with that. When you don't go for your regular cleanings to your dentist, what happens is this plaque or that I showed you, the soft white thing that you saw in one of the pictures, that has bacteria. The bacteria then migrate from the gums into the bone, and basically, simply put, they eat away at the bone. So that is the number one reason for bone loss, which is gum disease. 2 could be any systemic issues that you might have. Diabetes is a big one. And diabetes can lead to some of these again, because again, you have the same bacteria in your mouth that eat away at the bone. 3 is the position of your teeth that I already showed you. If the tooth is way out or way in, the bone around it is thinner than it should be. So instead of having equal amount of bone all over to hold this tooth in position, let's say this tooth is way out. Now this bone here is extremely thin. So you're going to start seeing bone loss in that particular area. So again, tooth position is a big one, which can lead to bone loss. Some of this is reversible, some is not. So if the cause was, just a position or cleaning or something, then yes, we do see some of the bone growing back. If it's very severe diabetes and really poor oral hygiene, then as dentists, what we want to do is just stop the bone loss. We may not be able to grow back the bone, but at least stop further loss.
Right. So the next one is a short and quick, which says, are there home remedies to whiten my teeth?
To whiten your teeth. So whitening is, again, a very personal thing. So to answer your question, not that I know of, what you can do at home is brighten your teeth. And what I mean by that is if there's a lot of plaque and tartar and such collected, if you just clean those teeth, I think some people have tried using certain mouth rinses and such that help them identify where the plaque is. If you just brush that off or go for your cleaning, you will notice your teeth look about 3 to 4 shades brighter and whiter already, because plaque is creamish yellow in color. So plaque and tartar, if it's accumulated, is going to make the tooth look darker. As far as whitening products are concerned, most of them are extremely abrasive. So yes, it should ideally be done under a dentist's care, because it can get extremely abrasive to your teeth, and you don't want to do more harm than good.
Great. So the next one is a pretty involved and a long question, which has been waiting for a while. It says my tooth number 19 was extracted in September, I think last year, September. It was ready for implant by December, but I couldn't get the process due to various reasons, and then due to COVID now. I didn't want to expose myself because of the COVID, of course. How long can I wait with the empty gap in that area? And what should I watch out for? Since I am diabetic, I am not going out anywhere, and I'm concerned about going into an invasive process for implant and then crown, etc. What are the potential risks of not doing the process now?
So again, great question, and I'm sure a lot of people are going through this because diabetes is quite common among us South Asians. Let me put it this way. Simply put, you're probably doing more damage by not replacing that tooth than by replacing it. Like I said earlier, COVID precautions now in dentist offices are very high. They follow all precautions to the T. However, even if you don't have to just go in and start the process. What you should do is go talk to your oral surgeon and ask them what kind of sterilization processes do they use now? How do they plan on protecting you? How do they plan on using these newer sterilization methods to prevent COVID from spreading? So what you should be watching out for, to your question, is that given the diabetes, there's a higher chance of the teeth migrating. So the gap that's there right now will close, will keep getting smaller and smaller. So you do want to watch out for that. And that is the number one reason why people go in and get the implants done as soon as possible. From, like I said, June 6th onwards, every dentist that's practicing is following very strict OSHA guidelines, protective equipment used to the teeth. There's very little chance of it spreading from one person to the other. However, if that is your concern, I'd encourage you to talk to your dentist and your oral surgeon about what precautionary measures they are using, so that they can explain, it better to you. Som, should I continue the rest of the presentation? You're on mute, Som.
The question is, will flap surgery of gum help the teeth to hold strong?
Flap surgery of gum usually helps with, yes, and then again, it depends on why they're doing it, but it's usually prescribed to cover more bone, to get the tooth more support, to prevent more gum recession, to prevent basically tooth loss. So yes, it does get the tooth stronger than it is. Does it get it to its strongest? Again, that depends on the cause of why the recession happened in the first place. Like I said, if it was, teeth positioning, then the flap surgery is only going to help so much without correcting the cause. But if it was something else that caused it, like habits, then perhaps yes.
Great. So I think we'll hold any other questions now. and you can set up the presentation and go for the rest of it. Yeah.
Okay. So,
But it's a good discussion. I think your break really helped to, connect very well with the participants. And thanks to all of you for putting your questions here. Thank you. And
yes,
if you
yes,
have some more, yeah, we still have time. You can do that right away.
yes. I'm going
Don't
to do
wait.
this pretty
Yeah,
quickly so that then we have some
yeah,
more time for
yeah.
questions.
No, you take your time, Nipa. We have time, so go ahead. Yeah.
Okay. Now let's talk about what happens if someone just doesn't really want to go through braces, because that's a lot, or doesn't want to, change their tooth position or any of that. Here we have this particular person who has some minor gaps in their teeth, but you can see the damage that these teeth have sustained. They're very thin, they're broken, they're uneven, etc. So now this person wanted to undergo some other form of cosmetics. So it is what we call a dental veneer or a laminate. So what you don't know is that these are porcelain leaves that are placed on top of the tooth. It looks just like your teeth, that's shaped like your tooth, colored like your tooth. It closes the gap, it's extremely aesthetic, and can mimic putting the tooth in their more ideal position. So simply put, if someone has seen how fake nails are put, you might have this short stubby nail, and your manicurist or whoever puts like this pretty nail on top, they shape it up, they clean it up, and then they can color it as they want. It's a pretty similar concept. Where we can, we roughen the tooth a little bit, and then the lab makes us these porcelain leaves, and then they're bonded to the tooth. It's a chemical bond, so it's usually very hard to remove them. So you can eat apples and such with it as well. So, for example, this person had spacing. You can see, and if they don't want to undergo orthodontics, then the next best thing is laminates or veneers. So you can see how they got these veneers done. Not only were the veneers closing the gap, but they also made the tooth a little longer, which is a lot more aesthetic for this particular person. Plus, you can make them whiter. So if someone says, I want my teeth color changed, okay, we'll make it a little whiter for you. So there you have it. This is how the tooth is usually prepared. So underneath, so when you have a tooth like this, we roughen the tooth in this respect. This particular person has a gap between their two front teeth. And then we get the porcelain leaf, and it's bonded here, and it closes the gap. So that's as far as cosmetics is concerned. I'm going to show you just very quick some celebrities that have had. In fact, if you open any celebrity's smile, most of them have had either veneers or some form of dental treatment done. But let me show you the most obvious ones that without dental cosmetic dentistry, they would not be the celebrities they are today. So number one, of course, everybody knows Tom Cruise. We have in dental school, these cases are stuff of what they educate us with, like how they went about changing this smile from this to that. And it's still not ideal, but it's pretty darn close. And he's undergone multiple treatments, including braces, veneers, some minor surgery, etc. So obviously you can see the huge difference in the looks and the smile and everything else. Here's Cristiano Ronaldo. You can see he's missing teeth. He was born with a missing tooth. So you can see that, and with short stubby teeth, misshapen teeth. How do we correct it? He's obviously had veneers done. These are veneers, and he's had them probably from molar to molar, from that tooth to that tooth. Plus they did some minor gum surgery to make his teeth longer. So again, you can see the huge difference in the smile. Priyanka Chopra, you can see she had these really short, stubby teeth. Some of these teeth are hidden, and now you can see how the present dentist has changed them to longer, and in the back you can see the huge improvement in the smile as a result. And of course, George Clooney, same thing, very short, misshapen teeth, all worn out, and then here are veneers. So again, cosmetics can do a lot, but of course it needs to be done the right way. So yeah. Let's take some more questions.
Yeah, definitely. So thank you, Nipa, for the presentation. Very elaborate, great flow. And I'm glad that in between we had some interesting intervals with some questions flowing in. Let's continue with that. So here, the next one is, what are the most common teeth diseases? And what are the simple precautions common people can take to proactively avoid them?
So the number one, like I said, is as a dentist that we face is gum disease. It's and especially among us, South Asian, Indian population that we've noticed, because our diet is not that high in refined carbs. So cavities aren't so much of an issue as gum disease is. And a lot of it just comes from this hesitation of going to the dentist to get your cleaning done, when that's all probably that you need to do for the rest of your life. Just get a cleaning done and you're good. It's just like your car needs an oil change, you know, to function well. Even someone like me who knows how to clean her teeth well, I get my cleaning done twice a year from the hygienist. So to keep optimum health, that needs to be done. If your dentist says you need a deeper cleaning, then so be it. But that's number one. Of course, number two is cavities. Again, cavities come as a result of either not brushing correctly, the food choices, not getting either checked or treatment done in time. So then the cavities grow and then they become painful. Now you need root canals, etc. But if intervened in time, dentistry is very simple. All you need is cleaning and fillings. It's really not too bad. Unfortunately, people wait because they think, oh, I'm not in pain. I don't, why am I getting anything done? I don't think I have a cavity. It's not hurting me. Well, when the cavity starts to hurt you, it's too late. When a cavity starts to hurt you, it needs a root canal. So when a cavity is only in enamel has no nerve endings, it is not going to hurt you. That is the best time to get a cavity fixed. So if your dentist is telling you you have a cavity, please trust them. Perhaps you can ask them to show it to you, and they might be willing to educate you, and then just get it resolved at that point. And it's a simple filling and it's done.
Okay, sounds good. The next question is water flosser as effective as a thread flosser?
Simply, the simple answer is no. It isn't as effective. However, it's a lot simpler to use. So people end up using it more than a thread flosser, in which case it's probably as effective. However, if you were to use a thread flosser as much as you use a water flosser, there's no comparison. What happens is the plaque is very sticky. So the bacteria are very smart. So it's a very sticky complex. It's actually, it's very hard even for us as dentists to clean you. You've seen all the instruments we need to use to remove this plaque and tartar. So it actually sticks to the surface of the tooth. So your water can only remove so much. It's not going to be able to remove the really sticky parts of the plaque, which only the thread, when you go in and get it out, is what's going to help. So, but if you're going to give me the choice of flossing is so boring, I don't want to do it, I'm only going to do it once or twice a week, as compared to no, I'll use the water flosser every day, then the choice is clearer.
Great, thanks. The next one, is mouthwash good or bad? Is using mouthwash every day uh, make us ingest unhealthy chemicals, hurting the rest of the body, even though it may help the teeth?
So mouthwash, the regular mouthwashes that are in the market today is not something I recommend using on a daily basis. You do not need to use mouthwash. Treatment, your oral hygiene routine should only be toothbrushing, flossing, cleaning your tongue, and that's that. Mouthwash should be used more as a freshener once in a while, if you're stepping out and such. The only change I would say is if you have a fluoride mouthwash and you haven't been asked by your dentist to avoid fluoride, then then it can be somewhat effective in preventing cavities. But on a regular basis, some of these mouthwashes have a very high alcohol content. So they can actually be counterproductive because they are dehydrating your mouth, so causing more cavities. Um, so think about it as not showering and putting on deodorant. It can only work so much. So I would rather that you not, because mouthwash also masks. I mean, if you use mouthwash, it's going to mask your bad breath, etc. So you won't go to the dentist sooner as you should. So it's almost like using a deodorant and not showering. So I don't recommend it. I personally don't use it. There's no mouthwash in my house. But if you want to use it, then use a zero alcohol fluoride one.
Thank you. So the next one is, we are now very much surpassing the time, but very quickly, this one, and there's another generic one. So we'll take two more questions and try to see how fast we can cover them. But this one is very interesting. Could you please talk a bit more about spacers, especially for children? We have been recommended spacers, though I'm not sure, is it considered 100% aesthetic, or is there a health perspective too?
Thank you for that question. Spacers are literally what they say. They make space for teeth. So as a child, in certain children, when you see the teeth very close together, it's a sign of a not so good smile coming up in their adulthood. Because in children, what we want to see is spaces between their teeth. Because as their jaws grow and the teeth get bigger, that's when the spaces close up. So if you have children where the teeth are very tight together, then you know that they're going to have issues as adults or as young adults. So that's when the orthodontist would recommend a spacer where they go in and make space for, so it's almost like preventive. Some of this can actually prevent future braces. A lot cannot. You have to do both, where you're doing preventive orthodontics and then going in and doing some minor orthodontics. But if you want to avoid full-fledged braces, then these things like spacers and expanders and little things that the orthodontist or the pediatric dentists do actually helps you prevent a lot bigger treatment later on. So yes, highly recommended.
Yeah. So just to end this program, I'm combining two questions together. One is a very generic one, and the other one is, of course, something interesting, which people obviously feel anxious about. So combining the two, it would read like this, is hereditary a factor for losing teeth at the age of, say, 50 years? So that's one part of the question. And second is, since we're ending the program with this, any advice, suggestions for senior citizens in this challenging time? So just combining the two, and we could wrap up with this. So yeah.
Okay. Hereditary. So the way hereditary works in dentistry would just be, again, your teeth size, the positions of your teeth, perhaps any diabetes, high blood pressure, any of those other issues that you might have inherited. As such, no, it does not affect teeth per se. So what I mean is, if your parents or grandparents had really bad teeth, but you took great care of it, you went every 6 months, you did your orthodontics, whatever else you had to do, then no, your teeth, you will not lose your teeth at age 50 or whatever it was that your parents lost it at. So these days, there is absolutely no reason for people to lose teeth through their lives. Dentistry has advanced so much that there is just, unless of course it's so bad, but then there are implants which you replace it with. So if you lose teeth, then you can replace them as well. And I'm sorry, so what was the other question?
General advice for senior citizens.
Senior citizens, my advice would be, just keep your teeth clean, brushing, flossing, cleaning your tongue. If you're wearing dentures, make sure that you keep your dentures clean. If they are sharp, if they are hurting, then these are emergency treatments that you should see your dentist for, or they're loose or ill-fitting or any of that. Yeah, that's about all.
Thanks very much, Deepa. This couldn't have been even more engaging than it was today. This is a very, very, I would say, all-encompassing as far as the oral health and dental. You started from aesthetics in dental health, and then we went into a whole variety of issues, challenges, and so on. So thank you very much. I'm glad that we could cover so much of ground. So before we end, do look up our website. We have a lot of events coming up. Register for them. And of course, there are lots of free online practices, sessions which are available in the website. Definitely take advantage of that. And yeah, look forward to having you for the next session. And once again, thank you, Deepa. It was wonderful to be.
Thank you for having me.
Thank you. Bye-bye.
Bye.